thing I'd like to do is tell you that we're very excited to introduce our speaker today. Haneen Abu-Ramella is joining us to tell us about Locumunity, and she has a connection to Alaska because she's connected to Dr. Shadi Bhatta, who's been a sort of health guy for the last couple of months. So Shadi told me about Haneen Abu-Ramella, and we had a wonderful Zoom conversation, and now I'd like to allow her to tell you more this afternoon about Locumunity. Before we get started, we have two bits of information. One is the last time we spoke, Kim asked for people to step forward to be part of our board of champions, and we've had 5 people step up to do that. We still would like a few more people, and we've opened up that until tomorrow afternoon. So if you were just on the fence and weren't sure if you wanted to step forward, then please let us know. In the last newsletter, Kim shared kind of what those responsibilities would be, and so please let us know if you'd like to participate. Next thing is that we're very excited that next week we'll have the Primera Test Kitchen team come to Alaska for Monday and Tuesday. They've got a whole series of meetings set up. And Justin, I see, is on the phone today. Please, we have a meeting this on Monday afternoon in which we're going to talk more about the startup for Health Tie, and Justin and his team will do a short presentation as part of that. We've had quite a few people agree to come, and then there's still a few spaces. So if anybody online is interested in attending, that's next Monday from 2 to 4, and you can reach me or any of the other Health Time members to learn more. All right. So with that, I'd like to welcome Haneen. Haneen, could you be able to present some slides and tell us more about Locumunity?
Yes, I'm just going to share my power. Let me just see the whole desktop, and I think that's probably better. Okay. All right, please let me know if you can see the slides.
We can.
Okay. So yeah, thank you for having me. My name is Dr. Haneen Abu-Ramella. I'm a physician and CEO of Locumunity. So my journey to entrepreneurship was unexpected. That was not something I had planned on in medical school. But a lot of travel occurs during medical training, and upon graduation from residency, moving back home, I noted that there was really no effective way for job-seeking physicians, specifically temporary physicians who are termed locums or locum tenens in the industry, to connect directly with medical facilities. And I thought the solution was quite simple, and so Locumunity solves this problem, and I'll explain how. So if you've never met a locum before, well, now you have. As I mentioned, I'm a locum physician or substitute doctor. I chose the locum lifestyle because it offers better pay, minimal administration, and a flexible schedule. I'm not alone. The US has close to 100,000 locum physicians, and this population is also growing with kind of the millennial physicians coming in, and that freelancer gig economy lifestyle infiltrating into medicine as it has in other industries. 94% of healthcare facilities reported using a locum in the last year. What I've found is the most frequent users of locums are community hospitals in urban, underserved, or rural areas that just don't have enough permanent staff and have to constantly supplement their workforce. So by the way, these 100,000 locums represent a $4 billion industry in the US and are part of a bigger temporary healthcare staffing market that is rapidly growing from $16 billion to $28 billion in the next 3 years. And I'll emphasize that the $4 billion that are recruitment fees for substitute doctors, this does not include the physician wages, and really consists of commission fees for placing physician A in hospital B for 3 to 6 months, and then moving them to hospital C for another 3 to 6 months. And yeah, this industry is growing quite fast, and that's mainly due to the aging population, more people accessing the healthcare system, and the increasing doctor shortages that we've all heard of. And that's in the physician world is mainly due to retirement. I also think, and there's some evidence in the literature to support this as well, that a big part of the problem is inefficient physician distribution and utilization. Anecdotally, I saw that with my own tendencies as a locum as I got familiar with the 3 practices that I knew, and it was very tedious and a hassle for me to find out about other opportunities. So I kind of just clustered at the 3 practices I was at. So the market is dominated in the US. So I should clarify, I am a Canadian physician. I do family practice and maternity care. And the problem I was tackling in Canada was really fragmented government job posting boards that were quite tedious to sift through. Whereas in the US, the market is dominated by these expensive recruitment agencies, and they charge 30 to 100% commission on the hourly wage of the temporary physician. Their systems are quite archaic and labor intensive, so there's a lot of high cost that goes along with physician recruitment currently. The pressure to create a better physician recruitment strategy is in the news and a priority for the National Association of Physician Recruiters. And to me, so I graduated in 2012 and had the idea at the time when I encountered the problem, and then got busy with practice, and was mainly through word of mouth that I found my next kind of locum tenens job, but kept seeing the medical literature about how smaller cities and rural areas struggle to recruit and retain physicians, how physician burnout is at an all-time high. And a lot of the times physicians in rural communities are overly stressed, overly worked. Even in urban centers, sometimes independent physicians, there's not so many of them in the US, but in Canada, those independent physicians who operate their own clinics have high degree of burnout because it's very hard for them to find a replacement to step away from their practice or take a vacation or just some respite. So what Locumunity does is we create a centralized marketplace that connects physicians and jobs through, job-seeking physicians and medical facilities through a data and community-driven platform. And we're starting with the temporary or locum tenens physician market, because obviously that was my experience and that's my area of expertise. In the US, we charge a transparent and fixed cost of 30% commission, creating cost savings. Our goal is to transcend beyond a recruitment platform. And so my goal is to leverage technology and our matching algorithm to provide high quality candidates that have the right fit, and do that with a short fill time, and create this thriving community of physicians that are connected, because the medicine is very much a trade, and locum practice can sometimes be isolating and lonely because you're moving around from practice to practice. And so creating that collegiality online is very important for these physicians. So this is just screenshots of how our platform looks like on the inside. I think sometimes it's helpful to get a visual of how things are. This is obviously our test site, and so this is Dr. Nina Simone. This would be a locum. The only way an employer would get to see her profile is if she indicated interest or applied directly to that job, and so that opens up her profile to that employer. She can search for jobs in 2 ways. This is the curated job search. So when we kind of created the site, we said, okay, what is the best in class of what's out there already? And so this was kind of borrowed from Tinder, where you swipe left, swipe right. Our site is mobile responsive. We don't have an app, but when you do open this with a mobile, you can see the past save buttons there. And when a physician passes on a job, we ask why. You know, is there something that would change your mind? What was the reason that you passed on this? A lot of the times we find that the things that they pass upon are negotiable. So start dates or hours or things like that. or they can start a chat with the employer if they want to inquire further. Everything's very transparent. That's the other thing about the platform, the pay, the number of hours, the support that you have. It's meant to give you a very clear idea of what the job entails, and you're really only asking questions if you need clarification or are interested. And then obviously you can apply as well. And then this is what I had envisioned was the Airbnb kind of search map. If, again, locum tenens do travel, they're, I guess, the equivalent of travel nurses. Most people are familiar with those. And so I wanted to be able to see, well, what would it be like to practice in rural Canada, or, you know, in the Northwest Territories, or in the US? It would be like, how would practice look like in Alaska or Hawaii, or all of those things, and to be able to see all that information on your at your fingertips instead of having to check and research and contact recruiters and get on the phone to just even find out if the job is even pertinent to you. So basically, again, that's our goal right now. We have a minimal viable product, so we do have those live feedback loops. So when the physician passes on a job, that feedback that they give us is anonymously fed back to the employer, so that the employer has a live pulse on how their job is doing, and they can alter things that maybe are common misunderstandings or questions that come up. The predictive modeling we don't yet have, but that would be in the future, is once you collect all of that data now, before the employer even posts a job, you can tell them what physicians in that area like, or incentives or anything like that. We do have the matching algorithm, so it is in its infancy right now. There's supervised learning there that is the initial elements of what I hope to be an AI operated matching algorithm down the road, but obviously we need more and more data to collect into there. And down the road, I would be obviously hiring a data scientist and that sort of thing on the team. And then same thing with profile cohort analysis. If you could really predict like who makes a good rural physician or a telehealth physician, what kind of characteristics or practice styles make certain types of physicians fit well into one setting versus another. And then linking those physicians together. So right now we don't have that, but that is the vision, is to be able to say, place the physician somewhere, but say, hey, 20 minutes away from you is another Locumunity physician who is at a similar stage in life with a young family, same specialty. You guys may want to get together or create continuing medical education groups where these locums can exchange or do sessions together that contribute to their continuing medical education credits. And this, again, just an idea of like our goal is really to collect as much data throughout the job search process as possible, to start integrating culture fit questions in our locum wizard when they sign up, instead of just questions about qualifications. So in terms of where we're at right now, we started in Canada summer 2017 with a beta kind of release at that time. We currently have about 1,900 physicians registered. This is keeping in mind that Canada has only 100,000 physicians total combined, and we have 300 employers. During Techstars Seattle, we did do a test pilot in Washington State, and we were able to create partnerships with some of the most trusted and respected names in healthcare. To me, the goal at the time was to do customer discovery in the US, to understand the parallels and differences between the Canadian and US market, and to prove that we are able to populate both sides of the marketplace. We did not go past that at the time, because obviously then there's the credentialing and malpractice insurance and all of that goes along with actually placing a physician. So we kind of just, that's what we wanted to prove at the time, then took what we learned in Techstars and implemented that in the Canadian market. And now I'm circling back to the US. So sorry, this is just some quotes from the CEO of Physician Services, who we met in Washington during our time at Techstars, that also recognizes the need for this industry to be disrupted. And one of our physicians, Canadian physicians, who's used Locumunity to extend her maternity leave by another couple of months. So my main focus, since we pivoted to the California market, or the US market, I should say that we chose California. Really, we listed states, multiple states, one of which was Alaska. California was the other contender, and the reason we chose California to start with was the density of physicians, so 100,000 physicians in California alone, and the ability and the geographic kind of variability. So lots of rural, but then lots of urban. And to me, because I want to focus on distribution and utilization of physicians, or effective distribution, I thought it would be a good place to start, because you could pull some of these urban physicians into some of these rural areas versus bringing an out-of-state physician, which is what usually happens right now with locum tenens, is a lot of them are out of state. Again, obviously the reason I'm presenting here is I am looking for community partners, and I'll talk a bit more about that. But really, I've been talking to healthcare executives, physician organizations, and recruitment agencies to further understand the market here. And now we are approved for malpractice insurance in California. I would say I'm 90% of the compliance, so I just have a few more things to kind of go through before being able to place a physician, but we're almost there. And these are target personas. Again, the community hospitals that are in those urban, underserved, and rural areas, and those primary care physicians, specifically those millennial physicians in their first 5 to 10 years of practice. I'll just gloss over that. This is the current team. There's been some changes since Techstars. And so obviously there's me as a CEO and physician. Yorota is our technical lead. And Katiana is from Georgia, and she's our remote credentialing specialist. Chris Mandarino, someone we met during Techstars. She's a consultant for us right now, and she has tremendous experience in startups, just wrapping up her 5th startup. Lupita is a healthcare staffing consultant from California, who I met during just customer discovery and doing all of that in my time so far in the last few months. And she's been very helpful in setting up all the handbooks that I need and paperwork that we're gonna ultimately automate. There it is. Our advisory board, currently there's only 2 people. Dr. Mike Halpern is a retired emergency physician, well known and respected in Washington State, and his input into the US market has been tremendous, and he has lots of connections. Nate just gives us that perspective of growth. He's the VP of product teams at Zillow. I've had several mentors during Techstars that have turned investors. So Jean Pauli is the former president of Microsoft Open Technologies. He's a repeat investor, and I talked to him this morning. I talk to him every 2 weeks for an hour, and so he's been mentoring me since the program. And then Adam Doppelt and Patrick O'Donnell are, I don't know if anyone recalls Urban Spoon, but they're the founders of that app, and they've been great mentors as well, because they've built multiple marketplaces. So really what I'm looking for is connections to community hospital executives and the potential for pilot sites where I can refine and build out the matching algorithm and really tailor the solution initially to kind of one system and then expand from there. And also looking for a physician recruiter as a potential co-founder, if anyone, or a healthcare recruiter, I should say, want someone who's familiar with a full desk recruitment, as they call it, which is basically not just physician recruitment, but matching, sourcing, and securing placements. But for me, again, the reason I was really interested in presenting and why Alaska, and again, Dr. Bata has been a great resource as well. And he, in talking to him, that's why we had listed Alaska as a potential to start with, and then ultimately decided on California. But for me, really, it doesn't matter where, if I can find that kind of hospital that really identifies with this issue as a big priority for it to be resolved. What I want to do is kind of take that opportunity and really tailor and start a pilot program there, and then branch out. right now what I'm doing in California is basically acting as a recruitment agency just to understand that side of things and to go actually through the full cycle of sourcing the candidates, sorting them, placing them. And I'm already seeing some deficiencies and deficits in the recruitment market and the tools that they use, which eventually I would plan to include and incorporate into the Locumunity platform. But initially, step one would really be, again, that pilot site that's really wanting to create something innovative and an understanding, I think, of what startups are like. I think the reason that some of our partnerships also in Washington, or I didn't feel comfortable continuing them, is they were like, Providence is a huge system, and to them they want someone who's able, you know, they have 900 vacancies every month for physicians that they're looking for, and I was not at that level at the time, and I'm not there yet either in the US. So a partner who's understanding of like, okay, this is a startup that is just starting out, so I'm not going to expect that they're going to place 100 physicians in my facility right now, but the understanding of the potential for me to be able to reach that stage and to recruit, you know, thousands of physicians, because there is high appeal to the platform. A lot of the physicians we recruited in the US was through my Facebook groups that are exclusive physician groups. You know, I posted on Physician Side Gigs group where I got 250 signups within 72 hours. So that's the kind of appeal that there is, and the market is ready for it, because there's a disconnect between what the locum tenens population wants right now and the methods that they can use to find jobs right now, which is basically only recruitment agencies. So I'll end there before I drain on. Yeah.
All right. Well, as I predicted, these tend to go very quickly. That was a wonderful presentation, and it's so such good timing, because we will have the Primera test, our test kitchen here on Monday, and we've got a whole group of people whose whole purpose will be trying to disrupt and look at these challenges. So what I would like to know is, do people who are online, have you got suggestions for Dr. Abu Ramel to tell us where she might find partnerships in Alaska and be able to really seize this opportunity? And if you do, maybe take the last couple minutes to let us know about that.
This is Lizette, and I am, I'm the executive director for a trade association that works with providers that offer developmental services for people that experience developmental disabilities. We're called AADD. But there is a very active and very powerful trade association for the hospitals and nursing homes in Alaska, and it's headed by Becky Hultberg. And she is a very powerful, articulate voice. And I think that might be a really, I think she might see very quickly how beneficial this would be for the small rural hospitals, who probably all are very active and belong to that association. So I think I have an email for her, but I will email Jacqueline. Should I email it to you? I'll email the name of the trade association and her name so the spelling is accurate. But I think she might be very interested in this and would be a fabulous resource.
Okay, thank you very much, Lizette. That's wonderful. Does anybody have any questions or some other connections?
This is Jerry with Alaska Behavioral Health Association. The other good point may be Nancy Merriman at the Alaska Primary Care Association.
Okay. Can you email us her contact information and I can share it with Haneen, please?
It's on the way.
Okay, thank you so much. Or put it in the chat. All right. I see some wonderful ecosystem supporters. I'm seeing Kai and Aaron. I wonder if you have any other ideas as well.
This is Kai. Jacqueline, I wanted to pass on a suggestion that a contact be made with Dr. Gary Ferguson. He's got some rich contacts, both with ANTHC as well as just working around the state doing development work in the associations. The other person I'd be curious to to have you guys hook up with is going to be Bill Dan from Professional Growth Systems. He's done a lot of work doing consulting work for the regional hospital associations around the state, and may have a good insight to some of the dynamics that they're facing these days. He's now retiring, but could be another data point more from a strategic planning perspective. And Dr. Gary Ferguson, a little bit more from the holistic care perspective, but also just the rural community issues. So I can pass along both contacts.
Okay, fantastic. So either share those with me personally or in the chat, and I'll make sure that Haneen gets those. Were there any questions about Haneen's presentation? It was such a wonderful one, full of information and showing us your entrepreneurial path.
If I may.
Yes, of course.
So, hi, Haneen. This is Nigel Sharp. I'm here sort of two hats. I kind of help with entrepreneurial ecosystem building, but I'm also part of the health side.
Hi,
Yes,
Nigel.
I'm really interested. Thank you for the presentation. It was great. I'm interested in, like, you know, you've obviously been through a program like Techstars, and I'm also a Techstars alum, so I can sympathize and at the same time empathize with that program. I'm interested in, like, how does Techstars help you, and what would you look for next if you were to go through another programmatic experience specifically aimed towards test bedding and piloting out a solution? Like, where did Techstars fall short in that lag? And maybe that's the wrong way of framing that. Maybe, like, what could we be building here in Alaska that would really sort of help us fill that gap that maybe Techstars isn't filling?
Yeah, that's a good question. I think for me, there's been, obviously I'm a physician by training, and so had no idea about startups or like how to run a business. And so I think the only place that Techstars fell short, and I don't blame them for that because they're meant to be an accelerator program, so they assume that you have kind of the fundamentals of business, of what's needed specifically to build a marketplace, which is a unique kind of problem to solve. But for me, really, the last year has been a lot of hard lessons and learning the business kind of fundamentals that I was missing. Really about like how to run a team, about assigning roles and accountability, and that foundation that I didn't have and was assumed that I had during Techstars, and didn't learn until I kind of made some mistakes, and then did another program called Hypergrowth Life here locally in Vancouver that kind of went over some of these things, and it was like an aha moment for me so I think for me, again, like I didn't come from an MBA or like a startup background. So all of those were hard lessons learned throughout the way. And I did lose two co-founders eventually, just because, again, one of which would have been really sorted out even before joining Techstars by just identifying roles and accountabilities, things that you thought were obvious to people or what other people's roles were. I think for Alaska, and I've talked to Jacqueline about this when I initially did the Zoom call for her, I think what would be really helpful for startups and what would be unique, and if Alaska could offer that, would be the opportunity to do more of these like pilots, to match companies with the pilot and then actually have them do them and help them accelerate while doing that. So providing them the help while doing a pilot in Alaska, and providing the help with like producing like white papers or research papers from that pilot study, those sorts of things that would be, I think, really another steep learning curve for someone who doesn't come from an academia background, again, such as myself, like how do I even start creating a study and things like that, or generating a white paper. Those would be really helpful and attractive. If basically you said the only way we'd accept you into the program is if we actually have a healthcare partner who's willing to pilot or work with you on refining the pain points and then piloting a program. And from that, we have a support team that will help you construct a study and come out with a white paper from that pilot study. I think that would be really unique and very helpful. Techstars offered a great network, and the mentors that I have are high caliber, and I wouldn't have met them otherwise. But I really think that that would have been, that it was kind of do it on your own through that network versus being like, okay, you're accepted into this program if you have a pilot partner.
Thank you so much, Neen. That was actually, I think I couldn't phrase it any better myself. I guess we're at that very important point with Health Ties. We're about to sort of grow into this phase where we want to do some initial pilot work. We are really trying to help facilitate innovative partners, meeting with testbed partners and allowing them to pilot out solutions like this. And we're always interested in that reason why, like, and why is it important? And like, you know, you're helping validate the demand from the entrepreneurial side. And it's really helpful. And it's nice that you've come from the medical side of this, because it shows that, you know, there are innovators and entrepreneurs hidden in the midst of just doctors and medical professionals out there who would like to go down these paths, and they need to have support around that. So thank you very much for the presentation. I know we're actually pretty out of time, so but I'll let Jacqueline wrap it up.
Well, thank you very much. And absolutely, what I really like, again, is that you've provided us with kind of our marching papers for Monday. We really need to find these places that we can do these pilot studies. And so with that fresh in our mind, we'll go forward and tell everybody at our next meeting about what's occurred as we move forward and go from kind of a discovery phase, as we've spoken about in the last newsletter, into more of a startup phase ourselves. So thank you very much for that wonderful presentation. I look forward to working with you in the future, Dr. Abu-Ramella, and you will be hearing from me as I reach out and follow up with some of these contacts that people have provided to us. So thank you very much, and I'll look for good reasons to bring you up north, okay?
Thank you very much, everyone. Thank you for all the tips and contacts. I appreciate that.
All right. Well, thanks everybody for your time, and I look forward to connecting with you all again.